Nutrition science, nutrition in pregnancy and lactation, micronutrients. The micronutrients involved with building the skeleton, vitamin D, calcium, phosphorus, and magnesium, are crucial during pregnancy to support fetal bone development. Although the levels are the same as those for non-pregnant women, many women do not typically consume adequate amounts and should make an extra effort to meet those needs. As always, it's important to read supplement labels carefully, with the aim of choosing a prenatal supplement that contains close to the RDA or AI for micronutrients and avoiding those that exceed the upper limit, unless under the specific direction of a healthcare provider. In particular, both vitamin A and zinc consumed in excessive amounts can cause birth defects. Beta-carotene is typically used as the vitamin A source in prenatal supplements because, unlike vitamin A, it doesn't cause birth defects. Foods and other substances to avoid. It's not just nutrients that can cross the placenta. Other substances such as alcohol, nicotine, cannabinoids from cannabis, and other prescription and recreational drugs can also pass from mother to fetus. Exposure to these substances can have lasting and detrimental effects on the health of the fetus. For this reason, pregnant women are advised to avoid using alcohol, tobacco, cannabis, and recreational drugs during pregnancy. Medical providers can help pregnant women quit using these substances and advise them on the safety of specific medications needed during pregnancy. Some substances are so detrimental that a woman should avoid them even if she suspects that she might be pregnant. For example, consumption of alcoholic beverages results in a range of abnormalities that fall under the umbrella of fetal alcohol spectrum disorders. They include learning and attention deficits, heart defects, and abnormal facial features. Alcohol enters the fetus's bloodstream via the umbilical cord and can slow fetal growth, damage the brain, or even result in miscarriage. The effects of alcohol are most severe in the first trimester when the organs are developing. There is no known safe amount of alcohol in pregnancy. Caffeine use should be limited to less than 200 milligrams per day, or the equivalent of about 2 cups of coffee. Consumption of greater amounts is linked to miscarriage or preterm birth. Keep in mind that caffeine is also found in other sources such as chocolate, energy drinks, soda, tea, and some over-the-counter pain and headache medications. It's also important to pay special attention to avoiding foodborne illness during pregnancy, as it can cause major health problems for both the mother and the developing fetus. For example, the foodborne illness caused by the bacteria Listeria monocytogenes, called listeriosis, can cause miscarriage, stillbirth, and fetal or newborn meningitis. According to the CDC, pregnant women are 10 times more likely to become ill with this disease than non-pregnant adults, likely because they have a dampened immune response. Other common foodborne illnesses, such as those caused by Salmonella and E. coli, can also be very serious in pregnant women. Foods more likely to be contaminated with foodborne pathogens should be avoided by pregnant women to decrease their chances of infection. These include unpasteurized dairy products such as soft cheese, raw or smoked seafood, hot dogs and deli meats. It's recommended to heat to 165 degrees before eating. Pâté and other meat spreads. Undercooked or raw meat poultry, and eggs, raw sprouts, raw dough, unpasteurized juice, and cider. Following standard food safety practices can also go a long way towards preventing foodborne illness. During pregnancy or any time, the CDC offers the summary of food safety tips. Cook. Use a food thermometer to ensure that foods are cooked to a safe internal temperature. 145 degrees Fahrenheit for whole beef, pork, lamb, and veal, and allow the meat to rest for 3 minutes before carving or consuming. 160 degrees Fahrenheit for ground meats, and 165 degrees for all poultry, including ground chicken and turkey. Clean. Wash your hands after touching raw meat, poultry, and seafood. Also, wash your work surfaces, cutting boards, utensils, and grill before and after cooking. Chill. Keep your refrigerator below 40 degrees Fahrenheit and refrigerate foods within 2 hours of cooking, 1 hour during the summer heat. Separate. Separate germs from raw meat, poultry, seafood, and eggs can spread to produce and ready-to-eat foods unless you keep them separate. Use different cutting boards to prepare raw meats and any food that will be eaten without cooking. Maternal health during pregnancy, especially during the first trimester. It's very common for women to feel nauseous, often leading to vomiting, and to be very sensitive to smells. This so-called morning sickness is misnamed because it can make women feel awful any time of the day, morning, noon, and night. Nausea and vomiting during pregnancy affects as many as 4 out of 5 pregnancies. Symptoms can range from mild nausea to a much more severe illness called Hyperemesis Gravidarum, which causes relentless vomiting and affects between 0.3 and 3% of all pregnancies. Most women find that their nausea and vomiting subsides by the end of the first trimester, but in rare and unfortunate cases, it can continue until the baby is born. Dietary changes can help alleviate nausea and vomiting. Here are some suggestions. Choose foods that are low in fat and easily digestible, such as those in the BRAT or BRATT diet, which stands for bananas, rice, applesauce, toast, and tea. The goal is simply to find foods that can be tolerated. It is reassuring to remember that pregnancy does not require extra calories during the first trimester, and a prenatal supplement can help meet micronutrient needs. An empty stomach can worsen feelings of nausea, so try eating a few crackers or dry toast before getting out of bed in the morning to avoid moving around with an empty stomach. It may also help to eat 5 or 6 small meals per day and to eat small snacks such as crackers, fruits, and nuts throughout the day. Many pregnant women experiencing nausea and vomiting find meat unappetizing. Try other sources of proteins such as dairy foods, for example, milk, yogurt, and ice cream, nuts and seeds, as well as nut butters and protein powders and shakes. Ginger can help settle your stomach. It's available in capsule, candy, and tea form. Ginger ale, if made with real ginger, might also be helpful. If nausea and vomiting remain unmanageable after making these dietary changes, medications may be necessary. Hyperemesis gravidarum, though rare, can be very serious. Constant vomiting can lead to malnutrition, weight loss, dehydration, and electrolyte imbalance. Hospitalization may be required so that women can receive fluids and electrolytes through an intravenous line, and sometimes a feeding tube is necessary. Getting help for this condition can be a frustrating process of trial and error, and unfortunately, there are still many unknowns about its causes and effective treatment options. As pregnancy progresses, another common complaint is heartburn, caused by gastroesophageal reflux. This is caused by the upward constrictive pressure of the growing uterus on the stomach, as well as decreased peristalsis in the GI tract. About 6% of pregnancies in the U.S. are affected by gestational diabetes. This is a type of diabetes that develops during pregnancy in women who didn't previously have diabetes. Gestational diabetes is managed by monitoring blood glucose levels, eating a healthy diet, and exercising regularly. Sometimes insulin injections are needed. If blood glucose levels aren't well controlled in the mother, the fetus will also have high blood glucose levels. This can cause the baby to grow too big, leading to a greater chance of birth complications and increased likelihood of needing a cesarean birth.